when I think about health problems in seniors, I think you have to start and stop with the GI tract. I mean, okay, I'm a gastroenterologist, I may be biased, but when you look at the prevalence of constipation and you look at the prevalence of diarrheal illnesses, it's very high. These are amongst the most common reasons for seniors to visit their physician. Also, one of the more common reasons for seniors to actually end up in the hospital. So if we just take the very specific diagnosis of Clostridium difficile colitis, this is something that is it's an epidemic. It occurs in all ages, but affects seniors even more so. They're more susceptible to this. So a course of antibiotics for a pneumonia, a sinus infection is way more likely to lead to this Clostridium difficile infection than it is in a younger patient. And so patients get hospitalized, they get dehydrated, they can suffer falls from loss of balance and lightheadedness, drop in blood pressure. So when you look at Clostridium difficile, you look at other infectious diarrheal illnesses, you look at different types of colitis, something called microscopic colitis, which is more prevalent in older females. All of these things are first going to show up by changes in bowel habits in the bowl. Then you add on top of that the issues of gastrointestinal bleeding, whether it be from diverticulosis, from colon cancer. These are real issues in the senior population. And again, we know that if you detect this bleeding, if you detect diarrhea, if you detect even constipation before, say, constipation gets to the point where the patient is impacted and has to go to the emergency room to become disimpacted, that you can really intervene early. You can give patients gentle laxatives for constipation. You can make sure they get the appropriate testing, stool testing for their diarrhea. And this is going to lead to better outcomes. And I feel like if we can diagnose things early, we can keep people out of the hospital, improve their outcome, prevent falls, and all the downstream effects that sort of come from that.